Hi everyone, I'm Laura. First of all, I just wanted to say thank you for all of your very interesting questions. It's lovely to know that young people in Spain are so interested in the health service in the United Kingdom. Now, the first thing that I want to explain to you all is that the health service in England and the health service in Scotland are very, very different. I'm going to talk to you today about the health service in my country, which is Scotland. So to answer your first question about how the wards are organised or how the hospital is organised, the hospital in Scotland is organised into things called wards. Each ward is dedicated to a specific type of medicine. For example, there is radiology for x-rays, there is orthodontics for your teeth, and there is maternity for where the mums and the babies stay when the babies are being born. Now, you also asked if there are children's wards in our hospitals. The answer to that is yes. Each hospital in Scotland has a children's ward, and all of the children, more or less all of the children that are in the hospital at that time are in a special ward together so that they always have friends, they have other children to play with, and they don't get bored. Okay, so I live in a town called Paisley, which is one of the biggest towns in Scotland. This also means that we have a very big hospital. Now, you asked how many visitors does our hospital get every year? Well, it's almost impossible to say, but I do know that there are at least 200,000 visitors to our hospital every year. We are a very special hospital because our maternity ward is very, very good. So lots of people from all over the country come to our hospital if they want to have their baby. Now, in the hospital in Paisley, which is the Royal Alexandra Hospital, there are at least 14 or 15 different wards. Some of the wards don't have numbers, some just have names, but there are lots and lots of doctors and nurses and patients there all the time. There are approximately 750 beds in the hospital, but that doesn't count people that come in just for one day, that come in for a couple of hours. That's just for people that maybe stay overnight or stay for a week or a month or whatever. So there are lots and lots of beds and lots of patients in our hospital at the one time. You also asked how many workers are in our hospital. Now, I'm not sure how many people exactly work in our hospital, but I can tell you that in the whole of Scotland, in all of the doctors' surgeries, health centres, hospitals, there are 161,000 doctors, nurses and healthcare professionals. Okay, so you asked if the hospital and the healthcare in Scotland is free. The answer to that is yes. Due to a thing called the National Health Service, or the NHS, it means that healthcare in Scotland is entirely free for anybody who needs it. This is perfect if you are really, really ill, or even if you need something simple like medicine from the pharmacy. We don't have to pay it. As long as your doctor gives you a prescription to say that yes, you need this medicine, all you do is take it to the pharmacy and they give you it without paying. So I understand that it's very, very different from Spain, but it's also a very good thing because it means that mums, grands, children, people of every single age are entitled to the same healthcare, the same level of healthcare, and no one has to pay regardless of how ill or healthy they are. The last question that you had was, in Scotland or in the UK, do you have a sanitary card? The answer to that is no. We don't have anything like a sanitary card because, like I said, we don't need it. We have our National Health Service, and that means that everybody is free. The only thing that you need to provide is maybe your address or your date of birth or things like that, because something I forgot to mention earlier is that the National Health Service is free, but it's only free for permanent residents of Scotland. So, for example, if you are from Spain and you are very, very ill, and you cannot afford a treatment, for example, you can't fly to Scotland, get free treatment and then fly back to Spain, unfortunately. That's not how it works. So you do have to be a permanent resident of the country and provide documentation or an address or something in Scotland to prove that you live there. Once again, I just want to thank you for all of your very, very interesting questions. I hope that my answers have helped you and that now you have a better understanding of Scotland's healthcare system. And also thank you for choosing me to be the person to answer your questions. It has been an honour and good luck with your project, everyone. Thank you.